Hey, I'm Dr. Ruth Roberts, the original holistic pet health coach, and with me today is Dr. Mila McManus, a functional medicine specialist at the Woodlands Institute there in Houston, Texas. Thanks so much for joining today. For those of you that do not know her, um, Dr. McManus has got an incredible history. She graduated top of her class from the University of Texas, Houston Medical School in 2000. She is board certified in family medicine, and she's also board certified in anti-aging medicine and a certified GAPS GAPS practitioner. She's been featured on the Michael Berry Show, Dr. Hotz's Wellness Revolution podcast, Great Day Houston, the Business Makers Radio Show, and recently published the second edition of her book, Highway to Health, a Nutritional Roadmap. So, Dr. McManus, thanks so much for joining us today. For those of you that may or may not know, I did get into the functional medicine world back in 2012 after being in practice since 1990 as a veterinarian, and attended the Institute for Functional Medicine's week-long course where I got introduced to those concepts and really solidified that, adding it on top of traditional Chinese veterinary medicine, for which I obtained certification for acupuncture, Chinese herbal medicine, food therapy in 2005 and 6. So I think we've got some pretty interesting perspectives on medicine here between the two of us.
Yes.
So you went through the normal ringer. So how did you start to think that maybe you should transition to functional medicine from conventional medicine?
Oh, good question. Well, I really just have been sickly all my life, and from the time I was born, and just kept piling on more health issues, more medications, just horrible allergies, eczema as a baby, colicky, gastrointestinal issues from the time I could remember using the bathroom. And then developed horrible acne in middle school, and then lots of hormonal imbalances, PMS, period issues, mood swings, headaches, insomnia started in high school. And college, anxiety got worse, tried medications for that. And I just always wondered, I'm a why girl. I just want to know why. I just thought, okay, fine. I'll just go to medical school and try to figure out how to fix myself, since nobody else can. Nobody else can tell me what's wrong with me. All of those years, nobody ever asked me what I was eating. And so I went to medical school, but I did not learn how to cure myself. I learned how to pile on more pills for every ill that I had. So I graduated from residency on at least 12 prescription medications. I had never felt worse in my life, never more tired. I was at my highest weight. I was just depressed, living on caffeine and so on. And so I ended up practicing family medicine for less than a year out of residency before I jumped ship and left the dark side to get into functional medicine. And it kind of fell in my lap the way I learned about it, and I had a wonderful mentor, and which, we're still in touch today. And it was the most life-changing thing I've ever done. And, when I was practicing family medicine, I just didn't have the time to talk to patients. I didn't have the time to delve into what's really ailing them. Nor did we really learn how to do that in medical school. We weren't really taught, well, make sure you find out what people are eating. Nutrition wasn't even a required class in medical school. So anyways, I jumped ship, never looked back. And it just was the most amazing decision I ever made.
That's amazing. So how did you, where did you train in functional medicine? Were you working with A4M or?
Mm-hmm. Yeah, mostly A4M. And yes, I'm a member of IFM as well, and been to just a lot of conferences. Like I said, worked with a mentor for years, and just lots and lots of research and reading. And how about you? What made you get into more holistic?
I got sick. I mean, that's how most of us doctors start to be better doctors, right? So I got diagnosed with fibromyalgia, IBS, IBD, whatever you want to call it. Um, and PMS symptoms, perimenopausal, yada yada, and was fortunate enough to find a functional medicine doc in Charleston, South Carolina in 2005. And at that point, I knew I had fibromyalgia. I'd seen so many of my clients come through with their dogs that had been diagnosed with fibromyalgia, and they were literally being turned into junkies. So they went from NSAIDs to uh, narcotics, and then all of a sudden they're asking me to write prescriptions for hydrocodone, which is a narcotic for their dogs. And it's like, oh my gosh. So I knew I did not want to go down that path. And and likewise, I mean, I went to a couple of conventional docs. They're like, well, try this pill. And that's kind of the extent of it. And I think that this was sort of the beginning of fibromyalgia, moving from being recognized as a hysterical condition, is how they actually was a classification in human medicine, until the 50s or 60s, and then they called it something else. But it moved from being a stress-related disorder to actually a real thing. And now it's myalgic encephalitis, or part of that group. Mm. But that's what happened. I mean, so I didn't want to be a junkie. I went to see a functional medicine doc, and he said, okay, stop eating processed foods. Let's do some food sensitivity testing, dial your diet in. Yep, you're hypothyroid too. Let's get you some natural desiccated thyroid. Start, lo and behold, over the period of about 6 months, I went from barely being able to get through my day and with a terrific amount of pain to really having a very, very easy time. And the internet's been a little dodgy all day. So I think that's what happens for a lot of us that go from conventional medicine, whether it's on the vet side, whether it's on the human side. We get sick and we figure out a way to help ourselves.
Yes. Well, I was so happy to meet you and talk about all
right.
All the commonalities between pets and humans.
I mean, you mentioned earlier that nobody talked to you about what you were eating. So is that part of what prompted you to start writing about nutrition?
Yeah, I got very passionate about it, way back when I grew up on the standard American diet. I grew up on cereal and ho-hos and ding-dongs and fast food and Diet Cokes and whatever else you could imagine. I was able, my parents
were dangerous.
Yeah. Mm-hmm. So yeah, I mean, sure, who wouldn't miss eating a Cheeto, but it's all those prescription drugs. So I really learned, I just took a really deep dive into learning about nutrition and joined my team to help with nutrition and went and got her master's in holistic nutrition. And so she was a big contributor to my second edition.
Cool. Yeah. And actually, I put a link up there where you can go to the root causes, to the Woodlands Wellness MD, and get your free ebook on nutrition. Figure it out with pets as well. Is that, I mean, we're basically feeding pets Doritos for the most part. If you read the ingredient list of the standard pet food, and many of you are aware of other better quality products in pet foods. So that was one of the big things for me too, is teaching people how to cook for their pets so that they're feeding a whole food diet. And what did you start seeing when you were working with your patients to start directing them towards a better diet?
Well, I see that there's resistance in a lot of people, cats included. My cat, she is picky, but you know,
Yeah,
and
I think cats are the worst.
other patients really grasped the concept. Body affects your health and how you feel. Yeah, absolutely. So it's been life changing for thousands of patients over the years.
And and that's kind of the thing, is that sometimes people are like, yes, I just want to feel better. I'm going to do whatever it is I have to do to get better. So I'm all in. Let me know what I need to do next. And they want to start slow.
I would say the vast majority jump in, they do what we say, and they get well. Some patients, we have to meet them where they're at and take baby steps. You got to wean a day, and living on fast food. I mean, that it's very difficult for people to just completely stop cold turkey everything that they're used to in their lives that make them happy. So we will start. It takes excerpts from Highway to Health and from our instructional booklet for our gut cleanse, and made a first steps to dietary cleanup booklet. So we'll give those to the people who aren't quite ready to really jump into the deep end, and we'll take baby steps.
That makes sense, because it can be super, super tough to make that transition from all the junk food, all the good stuff, to a better diet. And I think that's important. Same thing with pets. I mean, and cats especially, they are like junk food addicts, just like we are. So you've had that experience of trying to transition your kitties, and they're like, not so much.
Mm-hmm.
So right on. And I think, and I'm sorry, there's some, I think, folks jumping into the studio that probably were on the wrong link. So pardon the distraction. So the one of the other things is that you and I both know that there are certain things that are underlying every almost every condition. So we would call them root causes. What do you find are the best places to start thinking about that for people?
Absolutely. And then I'd love to hear your take on what you find the root causes to be most frequently for pets. So gut health is really, besides nutrition, which we already covered, but obviously nutrition is paramount. But addressing gut health, and so many people out there have no idea that they have compromised gut health. They may have no symptoms of, they don't have IBS problems or reflux problems. But they just have, autoimmune diseases or cancer or mood disorders, and don't realize that that's tied so heavily to gut health. And our gut health gets compromised for various reasons, from our dietary choices, toxins in the environment, and I'm sure I'm missing missing a million things I was about to say there. But antibiotics, other medications, steroids, birth control pills. That's what I was going to say. So, and that just causes an imbalance of the microbial environment in our GI tract. So it allows opportunistic microbes or opportunistic organisms to overgrow, such as yeast, fungus, parasites, opportunistic bacteria. And then there's the upper GI issues that occur for similar reasons. But one thing in particular are antacids. Millions of people are living on antacids. thinking that it's okay as long as it's controlling my reflux. I'm good to go. But how about let's get to the root cause of the reflux? And then you're going to end up with more issues when you have no acid in your stomach. You need acid to digest proteins, which are the building blocks of everything in the body. And you need acid as your first line of defense when you swallow food that might contain disease-causing bugs in it that would give you horrible food poisoning. And also it keeps the bugs that should be lower down in your GI tract, should keep them there. But when you don't have any acid in your stomach, you're inviting these critters from lower down the GI tract to migrate up and cause all these other issues just throughout your GI tract. So,
yeah, right on. I mean, it's the same set of issues because most of my conventional colleagues, the first thing they want to do if a pet parent is saying, oh, he vomits a couple of times a week, or he seems to have the herpes or something like that, the first thing is, here's a proton pump inhibitor, an acid reducer, or something like this. And then you've taken a situation that was not great and made it substantially worse right off the rip. And that's exactly it. We're handing out antibiotics like candy. I think on the human side, there's a lot more research in terms of the impact of multiple doses of antibiotics. Like for most women, if you've had one round of antibiotics, your chances of becoming obese are something like 30 to 50% higher. You probably know the stat better than I do. But it's the same issue with pets. We've destroyed their microbiomes. We're feeding them highly processed foods. So if they've been on antibiotics, steroids, non-steroidal drugs, then we're just inviting disaster to happen.
Yeah, I like to tell my patients who seem to just take antibiotics all the time, the first sniffle, they'll decide they're going to just go ahead and take Z-Pak or something. And I remind them that, animals are fed antibiotics to fatten them up before slaughter. You don't think the same things happen to us humans? I mean, it's one of many factors contributing to obesity, but it's certainly a big one.
Yeah, it is. And the other thing is that the more episodes of taking antibiotics, then the more compromised your immune system becomes, because you've basically whacked the base of your immune system, which is your microbiome, right off the rip. So right off the rip. So that's one massive root cause of disease. And you mentioned toxins and all this other stuff in the environment. Same set of issues with animals. If we know, for instance, that glyphosate or plastics, microplastics, nanoplastics are in all of us at this point, the scary thing is for pets is that they have something like 5x our toxic burden. So all of the things you talk to your patients about, we're dealing with in the pet world as well. So when you're talking with folks about what to do about reducing their exposure to some of these toxins, what are your suggestions?
Well, prevention is far superior than just trying to detox all the time. But my motto is ABD, always be detoxing. But starting with using cleaner personal care products, eating organic when possible, quit drinking and eating out of plastic containers, especially hot ones, like microwaving in plastics. You can find plenty of nice stainless steel glass bottles that you can be drinking, filling in the morning and drinking throughout the day instead of grabbing the plastic water bottles. Of course, those aren't great for the environment either. I realize sometimes it's a necessary evil. But really, avoiding the toxins in the first place is key. And our food is so toxic. Even the organic stuff isn't 100% clean. So why is it that you say animals are so much more toxic than we are? Is it the chew toys?
No, I think the big deal is that because of their size and because so much of this is in dust particles, they're wallowing in grass that's been sprayed with chemicals. They're licking their feet, they're licking their bellies. They're literally ingesting this, not only what they're eating and drinking, but also what they're cleaning off of themselves. So I think that's the big deal. And you're right. I mean, the chew toys are not great. The pet beds are often contaminated with the flame retardants, the forever chemicals. And then when we give them the prescription flea and tick stuff, we're literally either putting pesticides on their backs or putting a collar on or giving them a pill that contains pesticides that we know are going to stay in the body for 30 days and more often quite a bit longer. So their contamination level is so much higher because they're just snuffling it up for the most part. So it's kind of sad and crazy. But agreed. That's the most important thing. We can detox, and it's going to be an important thing to do every day. But reducing the intake of this stuff, being cognizant. What are your household cleaners? What are you bathing your dog in? And taking, if you look at the label of these things and you're like, well, I can't pronounce half of those things, then it's time for that to be out of your home. Because it's yucky stuff. It's not helping your family either.
Yeah. So what are a few
Yeah.
tips that you give your clients and your followers to help with the toxic burden? Like just a few.
First of all, right on. So clean water. So whether that's we use a Berkey filter we've been traveling with for years, distilled water. Even if you just get a carbon filter to take the chlorine out, you're better off than where you started from. So doing that, making sure that you're not using those like Glade plugins or indoor air fresheners. Those are full of all sorts of gnarly things. They impact pets much more than they impact us. And then really being careful about food. So canned food is cooked in the can. So now we've got this food that's been um, cooked inside of a plastic lined can, and the process of cooking it increases the advanced glycation end products dramatically. Plus, it then infuses all of the plastic into the food. The liners of food bags are notoriously high in PFASs. So it's just, unfortunately, all of this stuff is everywhere. And so it's becoming knowledgeable about where it is and what you can do to minimize the impact on your pets.
That's great. Thank you. I like it.
Oh, right on. So what are some of the other big things, big chunks of or root causes that you focus on with your folks?
Something that's really overlooked, and you mentioned it in the beginning when you were telling your story, is food sensitivities and food allergies. Food allergies are pretty obvious most of the time because they're immediate reactions. And so you can connect those dots and, put a peanut in your mouth and your lip swells up. You might realize, oh, I might have a peanut allergy. But food sensitivities are virtually completely ignored in conventional medicine. I don't know why. And I still can't figure it out. I've been doing this 20 years. And I don't know. And, but food sensitivities are delayed reactions. You're reacting to something you ate 2 to 3 days ago. And it's virtually impossible to connect those dots about what's making your joints hurt, what's giving you brain fog. Why are you tired? Why is your stomach upset? Why is your skin itching? Why do you have these rashes? Why are you cranky today and you weren't yesterday for no reason? So food sensitivities, while they're not going to trigger anaphylactic shock like food allergies can, I tell people food sensitivities can trigger anything from a skin rash to schizophrenia. So I've seen it all.
And so, the same deal. And so this is part of why we wanted to do this together, because it's the same concepts. We're all mammals. But one of the key things that I use, that my holistic pet health coaches use to support patients with chronic disease or pets with chronic disease, is food sensitivity testing. We're fortunate to have a company called Glacier Peaks that does a bioresonance scan. And a lot of my colleagues will be like, well, yeah, that's just woo-woo.
Yeah.
I'm sorry, I've compared it to the allergy tests that the companies do, the NutriScan test, and they're all roadmaps. This one is easy to do because it's a little bit of hair, a little bit of saliva, super simple for the pet parent to do and send in. And then you get actionable results. You get a panel of over 200 foods, so you know what's going on. And I think, you made the distinction between sensitivity versus allergy. And a sensitivity is something that your immune system has seen multiple times because your gut's leaking and it's like, oh, that's bad. I gotta get on that and attack it. And where the attack ends up stopping, as you said, it can be anywhere in the body.
Yeah.
So critical to remove those irritants.
That's great. So do you have health coaches all over where they do the bioresonance for the pets in real time, or do you have the owners just send in a sample of their hair?
Exactly. So we work with Glacier Peaks. They do the testing, and so the pet parent, you can buy a test from drruthroberts.com. You can buy it from Glacier Peaks. You get a kit shipped to you. You take a hair sample, saliva sample, send it out. The lab gets your results back in about a week to 10 days. And then you've got this, 3 pages of food sensitivities, environmental sensitivities. And then the question is what do I do with that? And that's where the coaches come in, because what they can do is help you construct a rotation and elimination diet for your dog, for your cat, so that you're pulling out all of the foods that your pet is sensitive to, and then presenting them a new set of foods every 24 hours so the immune system, the gut, stops reacting to the food. And
Let me
are you
get
still using rotation diets too? Sorry.
Yeah, we are. I was just going to say, let me guess some of your top food sensitivities and allergies that you see in pets are probably the same in humans too, which are corn and wheat primarily. What are the other common ones that you see?
It's really interesting. Wheat, not so much, because 20 years ago, that was like, oh my God, every dog is allergic to wheat or sensitive to wheat. So really, it's hard to find a pet food with wheat in it. But you're right, corn, soy, beef, chicken, and then weirdly, flax, because that's a superfood and it's in all the pet foods, carrots, green beans, because collectively we were like, oh, your golden retriever's overweight, give it green beans or carrots for a snack. And so again, if these dogs are obese, that means they're already inflamed, that their gut's already having problems, and then we give them something every day and they start reacting to it. So yeah, but it's the same stuff because it's the commonly produced, uh, conventionally farmed items that we're all eating.
Well, that's interesting because I really don't see a lot of carrot and green bean allergies because those are the staples in most human diets, at least the patients who come to see me because they're sick, right? So
Right
it's
on.
the stuff they're eating most frequently that they're becoming sensitive to, like, wheat, corn, dairy, soy, eggs, etc. So, but not green beans and carrots. Those are rare.
Yeah, that's good. Um, yeah, although personally, green beans, for some reason, I started reacting to those, but I was eating them a lot, so that's why, right? Is that something your clients, your patients have difficulty understanding? But I always eat salmon for breakfast, and then they react to it.
Yeah, I do. I get a lot of that, and my quick response is that's because you eat it all the time. You got to rotate your diet. There's this threshold, and your antibody levels to that food are way up here. So there's a threshold. If you were eating it on occasion, they'd blip up and they'd stay under the radar, right? But if you're eating it every day, and those antibody levels are going to pass that threshold and trigger symptoms. So that's basically how I explain it to people.
Right on. So when you see somebody come through your office that's got eczema or something like that, is that something that you have a fair amount of ease helping them resolve? And what are the steps you would start with there? And I think you guys diagnose atopy too, don't you?
Yeah, just in general you mean asthma, just anything atopic? Yeah.
Yeah, more skin related. So yeah.
Yeah, so I tell my patients that if something is showing up on your skin, it's because you got something going on in your gut, and you have to address gut health first. And nutrition goes along with that. It's like, we got to clean up your diet. We got to clean up your gut. We got to make sure you're nutritionally replete, because you can eat healthfully. That doesn't mean you're going to get all the nutrients you need. So that's another root cause. And, people say, well, can't I just get all my vitamins from foods? I'm like, no, sorry. Especially if you're not eating 100% organic, because of course that takes down the nutrient value in foods if they're not organic. And we can go into that later if you want to, but so there's just no way. And then there's certain nutrients like iodine, that's not in a lot of foods. Vitamin D, we have no good food sources of vitamin D. And and then it's not just we can't get enough from our foods, but then nowadays we have a increased requirement for nutrients just to mitigate the damage we're doing to ourselves on a daily basis because of stress and toxins and everything else.
Amen. And that's the thing. Vitamin D testing, and is it high, is it low, and what to do about it is really a hot topic, because there is a company that's doing testing, but we've also seen, they say, okay, your dog's low, bump up the amount you're giving. Oh, it's still low, give some more. And then all of a sudden it's got calcium deposits in the kidneys. So in veterinary medicine, I think we don't have as good a set of answers yet on that. But that's critical for immune function. Same thing. I mean, the soil depletion, especially if all you can, and I get it, food is not cheap. And if you're trying to feed a family and your dog healthy whole food, sometimes you got to go the conventional route. But as you said, the soils are depleted, so they are not nutrient dense. And so having said that, I've got kind of a short list of nutrients that I know will be deficient in home cooked diets, and that is D, zinc, choline, and selenium. And then some of the B vitamins I worry about, especially with our older pets. Are there specific nutrients that you're focused on in terms of supporting people with stress and sort of immune systems that aren't working that great?
Yeah, B vitamins are so important to help the body with stress, help us support our detox pathways, our neurotransmitter balance, and things like that. So I'm a believer in multivitamins. Not everybody is, but for me, it's like, hey, it's good insurance. Okay, if your body doesn't need that extra vitamin C that day, that's fine. You'll just urinate it out, no big deal. But at least it will help ensure that you're getting minimal amounts of all the nutrients. I mean, it just takes one single vitamin in your body that you're deficient in to affect your immune system, make you sick all the time. So I'm a big proponent of multivitamins, which of course have the B vitamins. Sometimes we add extra B vitamins for various reasons, especially if somebody has an unusual amount of stress, or they really need to be working on detoxifying, or they have the MTHFR gene mutation. And then probiotics. I'm a fan of probiotics, whether you get them from eating fermented foods or taking them every day or every other day. If somebody's on a tight budget, or they're like, I just can't swallow this many pills in a day. Also, okay, take it every other day or get a more potent one and take it twice a week. Or eat fermented pickles, make yourself fermented salsa. You can learn how to do those things. So, and then I like to rotate probiotics every once in a while, sometimes do a spore biotic, sometimes a good broad spectrum, sometimes Espoulardi, which is a yeast that acts like bacteria and acts like a probiotic, good bacteria rather. Digestive enzymes, I have a lot of patients on those to help with all the GI issues, help with reducing the inflammation and allergenicity of foods that they're eating. I do put pretty much everybody on vitamin D with K. So you brought that up earlier about the pets getting calcium deposits. Well, It may be that they just need a better balance with the vitamin K. Like, I don't know the physiology of dogs and cats, but with humans, anyways, the vitamin D makes you absorb more calcium. The vitamin K tells that calcium where to go, which is go into the bones instead of your arteries and kidneys and joints.
That's always helpful. Yes. Yeah. And I think that's kind of the deal too, is that the way we're testing for vitamin D, we're looking at what's in the blood, but it's not necessarily reflective of what's at the cellular level. And so a more appropriate test for us may be the hormone that helps to drive vitamin D around the body. But I think that's kind of this is one of the differences in physiology that makes it a bit um, a little more challenging. But you're right. I mean, vitamin K would help drive the vitamin D into the cell, and so maybe then we wouldn't need as much. But we are not quite that advanced. And the other thing I want to thank you for is pointing out that, yeah, we've got the alphabet soup of vitamins and minerals, but one deficiency can disrupt the entire balance of the rest of all of these minerals and vitamins. And so that's something that's really difficult for most people to wrap their heads around. Um, so it's kind of out there. There's a lot of pushback right now on synthetic vitamins because of the way that they're produced. They're mostly petroleum based. So and I get some of that, but I think to some degree, we may be throwing the baby out with the bathwater and by saying no synthetics ever again. So I think it's a pick and choose kind of thing. What's your sense on that in terms of synthetics versus food-based sources?
I'm
Trying
fine
to
with
construct a
food-based.
vitamin. Yeah.
Yeah, I'm fine with food-based sources if somebody has really vetted the product that they're taking, and if their gut is in good health, which most of our patients aren't, at least not initially. And I don't want them taking a whole food vitamin because they're going to start causing food sensitivities to carrots and berries and kale and broccoli and whatever else is in that whole food-based vitamin.
Right on. And that's been my idea as well. I mean, if we're starting with a patient with leaky gut, we're putting them on a rotation diet. Do we want to put them on a supplement that's going to present the same food antigens every day and create sensitivity there? So I'm with you on that one for sure.
Okay, good.
Um, yeah. So one of the things that I think we both face with kind of a different variation is behavioral issues or um, for you, depression, I think, is something you see quite a bit of. Anxiety, we both see a ton of that.
Mhm.
What are some of the other sort of mental health issues that you can see really be impacted by just taking basic steps in functional medicine?
Yeah, we do see really good results with dealing with depression and anxiety, and OCD is just, as you probably know, extreme form of anxiety, and anxiety has become so rampant. Um, it seems like it's much more common. I see a lot of PTSD patients, who have PTSD from, being in the military or having some kind of trauma in their history or ongoing trauma, even people who have health anxiety and they have PTSD from having a really bad health episode, can create some PTSD with them. A lot of attention problems, a lot of cognitive issues in general, we see a lot of because of toxins, hormones, gut health issues, etc., nutritional deficiencies, food sensitivities. I mean, all of these things. I mean, of all of the thousands of symptoms and diseases that are out there, I mean, the root causes boil down to about 10 things. You got a mood disorder. Okay, here's your top 10 root causes. You got a rash. Here's your top 10 root causes. So.
Right on. And I think, for both of us, we both start looking at gut and repairing the gut. For animals, what we're just starting to really get the idea of is that, oh, wow, if their toxin burden is so much higher than ours, and we know that, for instance, various heavy metals can cause anxiety, aggression, that kind of stuff. I think that's another one. And again, you've got to get the body in shape to be able to detox efficiently and not make the pet or the person feel worse. But yeah, I mean, that's just so we've got gut issues, we've got the inability of the body to detoxify properly, and then contaminants or poisoning, really. So heavy metals, molds, um, Lyme, I think is getting to be a bigger and bigger issue for dogs. And then there's a few other bits and pieces. Is that kind of your sort of general go-to list as well?
Yeah, microbes are a big problem, and we're all exposed to bacteria, viruses, parasites, mold, fungus all the time. And I just tell my patients, we all need critter control. You do, or just go eat sushi and do a parasite cleanse. Eat uncooked pork. Not
Right on.
properly pork. You're asking for it, and just contaminated, unfiltered water, and just you name it. So I think everybody occasionally needs to do a good parasite cleanse, get rid of, yeast and fungus. Mold issues are rampant here in Houston, where it's hot and humid all the time, which is a favorite environment for inhaling mold. And of course, a lot of people may not realize that when they are riddled with mold issues, that it's not just what they're breathing in, it's in their food supply, and that's a big source, just coffee, right? Drinking coffee every day and not realizing that most coffee is contaminated with mold.
Yes. And that again, that's actually the real reason I left South Carolina. My risk tolerance dropped dramatically for storms, but I had a massive mold exposure and actually had to retire from practice for a while because I had some really significant cognitive impairment. But getting out of that humid environment, being really cautious about what foods I was eating, what I was drinking. Coffee was a bear, trying to find something that was not so contaminated with mold. So that was a real battle. But our pets, again, if we know it's in our environment, they're going to have, again, 2 to 5x the level of burden that we're carrying. So it's really tough. Um, when you start doing parasite cleanses, what are some of your favorite ways to approach that? I'm assuming you're not handing out fenbendazole or albendazole for people.
Well, that depends. Sometimes we use mebendazole, ivermectin, um, those for specific issues, but we like Cellcore products, and they make it easy. Their products have worked well for our practice, and it's just an easy regimen for patients. Like, here, take this for a couple months, take this for a couple months, take that one for a couple months, and we've seen good results with those. What do you do for
Right
pets?
on. That's actually what we're working on, is developing protocols that are using Cellcore products with the Para 1, Para 2, Para 3 to start to gently remove parasites. And I think our pets, again, they've got a fairly high level. What's really interesting is, for decades, the deal was, okay, here, give your dog this heartworm tablet every month. It'll take care of the intestinal parasites too. And what we ended up doing was actually creating resistance to those drugs. So if we, whoops, yeah. So so it just stinks. So we actually have to really be cautious about using prescription medications now. For instance, we're seeing a lot of giardia. We used to use a fenbendazole product to treat that, or metronidazole, which is an antibiotic, which is pretty tough on the body. And they're resistant to it now. So we're having to be really cautious about what we do. And that's why using an herbal approach is more effective, it's more gentle. We don't see the side effects that we would with some of these prescription products.
Yeah, that's
Yeah,
great.
but
I'm
yeah,
curious what people come to you and your coaches for with regard to their pets. are most of them like, oh, I just want to keep my pet healthy and live a long time? Or is it a few or several specific issues like, oh, I need help. My pet's not doing well because of XYZ?
The really sad thing is the vast majority of what we're seeing is cancer. In I mean, the horror and part of the problem is that we spay and neuter, which has helped us alleviate the overpopulation problem. But we're now in a situation where 25% of all dogs and 50% of dogs over the age of 10 will develop a malignant cancer. I mean, that's just ridiculous. And we've never allowed them to have a competent endocrine system. Cancer is a big one, and it's the ugly stuff. Things like hemangiosarcoma, osteosarcoma, lymphomas, mast cell tumors are a big issue. And then, it's sort of the list of chronic diseases that you're probably seeing with frequency. Gut disease, so IBS, IBD. We see SIBO in pets, so the small intestinal bacterial overgrowth, um, chronic vomiting. For kitties, it's really sad because a lot of times IBS will end up developing into lymphoma, which really stinks. And then skin disease, kidney disease, liver disease, and then autoimmune disease. Those are really bone and joint disease, arthritis. So just sort of the common sad list of things that's become a normal part of modern life.
Do you guys, holistically treat for cancer? Do you have protocols for that?
We do, and we've had one of our coaches actually had amazing success combining both conventional therapy and holistic therapy to support her dog with histiocytoma. And the reason that's astonishing to me is that the vast majority of dogs that I saw with that particular cancer were gone within 6 to 8 weeks. She's been able to support her dog out 12 months, which is amazing, absolutely amazing. And, her goal was not to cure her dog of cancer, but to give it its highest possible quality of life during the time that it had left. So,
Sad.
how
Yeah.
about you? Are
We
you
do.
seeing a lot of cancer patients too? Yeah.
Yeah. It's become such a rampant problem. And we see all types of patients with all types of cancers in all different stages. So we do a lot of complementary cancer therapies with people, and it's just not a problem that's going to get any better. The stats
Amen
of
to that.
cancer, same with humans, also getting a lot worse. So what were the stats on the incidence of cancer in dogs 20 years ago? Has it changed a lot?
Yeah. I mean, I've been in practice since 1990. For me to have seen a case of cancer back in the 90s up until maybe 2000, it was really unusual. I was treating maybe 3 cases a year. So, for frame of reference, in Italy, there is a cancer um, society here. This is a country where they don't typically spay or neuter, and the incidence is 1.1% in male dogs and 3.26% in female dogs. And I would say that's what it used to be back in the good old days, so to speak. Um, so, I mean, that's a huge difference.
Yeah, I'll say. Wow.
One of the other things I wanted to bring up, the number, if I'm remembering this correctly, in people, the number three cause of mortality and sickness is basically misdiagnosis or misprescription. And I know that went down during COVID for a bit, but is it back up in that number three spot?
Yeah. Yeah. It's properly prescribed medications. It's not even taking them on accident or taking the wrong dose. I mean, the incidence of drugs killing people is really high with properly prescribed. But also on top of that, I tell patients, if you want to stay healthy, stay out of the hospital, because there
Amen.
is a huge problem with things being misprescribed and misunderstood, miscommunications between the nurses and the doctors, and doctors having to visit a patient every 2 minutes or whatever, and they don't have time to thoroughly look at charts, and people are getting prescriptions accidentally administered that they're allergic to, or that has a horrible drug interaction with something else the patient's on. And I read a recent article that I think it was like 30 something percent of people are misprescribed something in the hospital every day. That's a lot. So if you're there more than 3 days, that's almost 100% chance it's you.
Yeah, exactly. Yeah, and I think actually what they call it medical error. I don't think they could find a term that really softened that up too much. But that's the thing that's horrifying is like they're theoretically prescribing it the correct way. It's just that they haven't completely checked the entire record to know if it was an issue, or doing the wrong procedure, or any number of things. And I think we simply don't have those stats in veterinary medicine because everything is so decentralized. We all, as veterinarians, we all have different practice software systems. We don't have good reporting for um, stuff that happens that shouldn't happen. Like I think that in every hospital there's a review board for any problems that occur. Um, that doesn't happen in vet med. So that's part of our problem. I think the problem is big in veterinary medicine. It's just that we have no idea how big or small it is at this point. But
Wow.
I mean, we're getting, especially with the monoclonal antibody drugs like Librela and Cytopoint, the side effects we're seeing are just hideous.
Like what? And are those mainly used for autoimmune disease?
No, so Librela is actually used for arthritis, and the way it works is by reducing the ability of the receptor that would say, "Oh, ow, this hurts," to receive information. And I mean, the side effects are anywhere from acute death within 24 to 48 hours of taking the drug to, just bizarre neurologic stuff weeks later. Um, with Cytopoint, this is a drug used to control allergies. Again, monoclonal antibody, so it inhibits a specific interleukin, which is related to itchiness. And thankfully, the major side effect is it just stops working after a while because the body's immune system begins to say, oh, this is a foe and I have to attack it. But there are reports of dogs experiencing really severe, almost anaphylactic reactions, developing autoimmune disease, all sorts of crazy stuff.
Wow, that's awful. It made me think about vaccines. You want to touch on vaccines for pets?
Sure. Yeah. It's interesting. I think that we've had more conversation about vaccine than you all have on the human side. But even though the first paper about duration of immunity was released in 1993, the majority of my colleagues are still trying to vaccinate many pets every year. And the issue is that they're not innocuous. Like when I finished veterinary school, they literally told us if you're not sure what to do, just prescribe some amoxicillin. It won't hurt them, and that's an antibiotic, granted. But the idea is that these things are, there's no side effects. There's nothing to worry about. And I think it's been clearly documented that overstimulating the immune system can lead to some pretty disastrous consequences. Autoimmune disease being one of them, teeing up the body to develop cancerous tumors because again, the immune system surveillance system isn't working well. One of the cool things is that uh, we do have some success with getting my colleagues to actually do blood titers to see, is there enough antibody around to protect this dog from this particular disease or this cat. but it's still a challenge. I mean, there's still so many of my colleagues that are out there. Oh, it's time for your annual vaccines. Let's just do it all up. Or, I'm so sorry that your cat is critically ill, but I can't see it until we do a rabies vaccine, which is just a clear contraindication for vaccination.
Yeah, my sister had her dog, took her dog to the vet not too long ago, and they forced 4 or 5 vaccines at that point, and poor thing was dead in 2 months from neurological disease that they couldn't
Wow.
figure out. It was sad. And I mean, vaccines are not benign in humans either. So
No.
it's, you got to be careful. Not everybody needs them. And I wonder how much is also money motivated. It's like,
I think
oh, if
it's
you,
laziness. It's just flat laziness. Like there were back in let's see, this is about 2004. Three of my colleagues came and said, "Hey, how did you do this in your practice? How did you take vaccines away from being your main money maker?" And so I sat down with them for 3 hours and explained everything and explained that, you got to use your brains, guys. This is why you went to veterinary school. And, you need to do some lab testing. This is actually what's going to be more beneficial to your patients and help prevent uh, things from becoming a big disaster. And after that 2 or 3 hours, they looked at me and said, uh, "Thanks for doing this, but this is just way too hard." And it's like, really? So I think that's it. It's a huge money maker. It's easy. You don't have to think too hard about it, but really, it takes no brains whatsoever to go through a really bad vaccine protocol.
wow. So you recommend checking blood levels, telling people when they go to the vet, say, instead of just blindly giving my pet all these vaccines, check some titers and let's see if their immunity's still fine.
Right on. And you, as the pet parent, you need to take responsibility and look at in your area what is the incidence of all the vaccines that the vet's suggesting. So, for instance, leptospirosis in your area, Mila, is a problem. But how effective is that vaccine? And that's the big question mark. It's questionable as to how effective it is. In the middle of Kansas, do dogs need leptospirosis vaccines? Well, the incidence there is extremely low. So no. So I think that's part of it too, is just educating yourself about what is an issue in your area.
Yeah, that's a good idea. Thank you for that.
Sure. And and I mean I think you're probably cleaning up a lot of mess from post-vaccine syndromes right now. Is that something you're dealing with in your patients too?
Oh yeah. Yeah.
I know that
Uh,
that's a charged topic. Yeah,
it is. We'll just leave it generic. But yeah, I see a
fair
lot of it.
enough. Yeah, fair enough. Cool, cool. I think we've hit a lot of kind of similarities between what's happening on the human side and the pet side. Anything you feel like we've left out?
I'm curious about genetics. That's something that we like to look at, the genomics, the SNPs in humans. Is there application for that with your pets?
It's interesting. We are really far behind on that. There is a company called Embark, EMBARK, that has good research, and they're actually looking at specific SNPs or parts of the genome for specific breeds. Like, okay, if your dog has this particular SNP, what does that mean health wise? And one of the more commonly known ones is the MDR1 gene, which is common in collie dogs. And that typically indicates that they may have difficulty processing specific drugs like ivermectin. But beyond that, we're really just in basic understanding of how to use those types of tests.
Okay, well, you can lead the front on that, I'm sure.
I think that's up to Embark. They're actually working with Cornell University, which is awesome. And they've identified a few more things that are super useful. And the idea is because they're coming from the conventional side, they're like, well, this could happen for your dog, but there's really not much you can do about it. Versus, I think you'd be like, yes, you have this particular gene, but that gene isn't your destiny. Is that a fair statement?
Absolutely. Yeah. We like to do those tests. They give us good information. They can explain some symptoms and diseases that our patients have, but also give us direction like, okay, well, now that we know you have, MTHFR and COMT and et cetera, that we have workarounds for that and supplements that we use to help mitigate the reactions that people get because of their SNPs, we call them, their little genetic mutations. We were talking about behavioral issues earlier. Are there a few or one or two major root causes of behavior problems in pets, or is that too big of a topic?
No, and actually, it's super interesting. And the majority of behavior things that we see are anxiety and phobias. And separation anxiety in particular. What's
Mm-hmm.
really sad is that a lot of it is related to early spaying and neutering. Like we saw separation anxiety skyrocket in the 2000s. And it took us a long time to understand what the mechanism was, but that's it. And then so we spay and neuter. Okay, we needed to do that. But then if we're still feeding the Dorito diet, the highly processed corn-based food, it
Yeah.
really makes it difficult to support these pets with anxiety. So
That makes sense.
we're back to that list of diet, gut,
Yeah.
and controlling inflammation and the ability to detoxify.
Yeah, the hormonal imbalance, that makes a lot of sense. We know that estrogen dominance or progesterone deficiency, however you want to say it, can create a lot of anxiety and mood swings. And, men who have low testosterone, if they were castrated, like poor doggies, and cats, that can also cause a lot of anxiety and depression and stuff like that. So that makes a lot of sense.
Right on. Right. And then what's actually happening with pets is they have about zero estrogen, progesterone, or testosterone. But what happens is their luteinizing hormone level escalates 20 to 30 times normal, and it's actually inducing receptors in tissues that shouldn't have them. The brain is one of them, the adrenal glands, the gut, the bones, the joints, the liver, the kidneys, everywhere. So that seems to be really more of the issue. And there are some folks that are looking at, okay, if we do testosterone replacement, which we can especially for dogs that are arthritic or have what we call the frailties of aging, we can start to see some real improvement in how they're feeling and acting. And then, interestingly, using a gonadotropin releasing hormone inhibitor, which is what starts the overproduction of luteinizing hormone, can reverse a lot of these conditions as well.
Oh, that's interesting. So do y'all ever use hormones in cats and dogs for
We're
diet?
at the infancy of it, but again, if so it's crazy. We can use testosterone in the way I described, and then for female dogs that develop what we used to call hormone-related urinary incontinence, we can prescribe estrogen. And we not only fix the urine leaking, but we help these guys feel better and lead longer lives.
That's
So
great.
somebody else has got to start working on that one. Yeah, it's cool. Well,
That's awesome.
awesome. Cool. Well, thank you so much for taking time out of your busy schedule to do this. It's been fun bouncing this back and forth. Hopefully, everybody has enjoyed what we've been talking about. And
I think she froze. Well, the pleasure is all mine. This was such good information, and I thought it would be great to get some information out there to our followers about all of these things. And, there's not a lot of those advocates out there for our little fur babies.
Right on. And likewise, I think that people on both sides of the leash need to know, the pet and the person need to know that there are options. And so if you're in the Houston area, again, go check out, I'm going to drop your book link in one more time, but go check out Woodlands Wellness, md.com. You'll find some amazing information. There's a lovely free ebook for you on that link. And the other thing for those of you watching on the human side, if you are struggling with a chronic health condition with your pets, that's exactly what the Holistic Pet Health Coaches are here to help you with. So dropped a link in there where you can find the coaches and also a discount code for your first session. Dr. McManus, again, thank you so much. Appreciate your time. We'll see you soon, and we'll see everybody else at a future time.